Okay, Assalamualaikum. Hi student. Okay, so first of all, this is the briefing practical for the students for PHC635 Introduction to the Clinical Pharmacy. Okay, so for your information, this practical aim for you to get used and to have some kind of the general idea about the flow and format of the OSCE and what you need to do during the OSCE sessions. Okay. Okay, so this practical, it will be conducted this week on Thursday and next Thursday. Okay, 18 May and 25th May. From 2 to 4 p.m. Okay, so this week, practical one, it will covers the step 1 until step 3 in the pharmacist patient care process, PPCP. Okay, and next Thursday in practical 2, it will covers the remaining steps in the PPCP, which is step 4 to 5. Okay, so the venue and the lecturer in charge of the respective group, I will email them. I will upload in the future. All right. Okay, so basically, the practical session aim to guide the students to conduct the step 1 until 5 of PPCP with the guidance of the clinical pharmacy lecturer. So you will well rehearse with the flow and format of the OSCE that we plan will be conducted around July week 13. Okay, so the following are the learning outcome of the practical session. Okay, so basically, at the end of practical 1, students are expected to be able to conduct the patient's interview and demonstrate an effective of communication skills. And then second, you are expected to identify and justify the drug-related problem or DRP. And then the third one, to develop a care plan, okay, for the practical 1. All right, so in the next practical 2, you are expected to propose an implementations of the care plan and then propose a follow-up or monitoring measure. Okay, so half step in the PPCP will be covered in the practical 1 and the remaining step in the practical 2. All right. So basically, for the group distribution, each of the lecturer will handle 15 students. Okay. So you will have 15 students in one lab. Okay. So in each lab, students, you must divide yourself into 3 small group comprised of 4 to 5 students per small group. Okay. So I will really appreciate if you can engage in and contribute asking the question during the group discussion. Okay, I already informed the tutors that you will actively ask the question during the practical session. Okay, so in this practical session, you are also allowed to bring in any drug information handbook such as the memes, BNF, and etc. You also allowed to use your smartphone or any device with the internet access to search for the references or material as well. Okay. But please be reminded that during the OSCE, the real OSCE session, the smartphone or any device will not be allowed during the OSCE session. Okay. All right, so basically, this is the general idea of the activities that will be conducted by the tutors and the time and the allocated time. Okay, so first 5 minutes, the lecturer will conduct a briefing. Continue with 10 minutes of the students reading the case that I'm already upload in the future, and then you discuss among your small group. Okay, so after you already discuss among your small group, you need to identify what is the question, what is the draft of the question you need to ask to the patients. Okay, so the first step is collect the information or history taking. All right. Then after you already identify the question, one of the representative from the group 1, they will conduct a role play or patient interview with the lecturer. All right. So the next 10 minutes after you already conducting your role play, they will have one sessions of the discussion. Okay. So lecturer will provide the feedback. All right. So step 1 is done. Continue with the step 2. In the step 2, you move back to your small group and then you discuss the drug related problem based on the history taking that you are just taking just now, based on the interview that you are conducting in the previous step. And then after you already identify the DRP with the justification, one of the representative from the group 2, you need to present the identified DRP together with the justification in the lab. Okay, and then after the presentations, the lecturer will carry out another discussion on the DRP identification. Okay, uh, next is the step 3. Okay, after you already identify the DRP and justification. In the step 3 is plan. Okay, so you move back to your small group. You discuss the plan to resolve the identify DRP that you identify in the second step. Okay, then once you already identify the plan to resolve the DRP, the next 5 minutes for the one of the representative from the group 3 to present their plan to resolve the DRP, and then continue with the discussion by the lecturer. Okay, so the step is a discussion among small group. One of the representative will conducting of the presentations based on the needed steps, and then the discussion. All right, so in the last 10 minutes, one of the discussions will be conducted to reflect on your performance, such as the strength, weakness, and some kind of the sharing session. You are allowed to ask, maybe in terms of the format, in terms of the advice from the tutors regarding the OSCE session. Okay, in the step 4, for the second practical, next Thursday, we will continue with the same case, but with the remaining of the PPCP step, which is step 4 and step 5. Okay, for the step 4, we will continue with the implementation plan. Okay, and then presentations from the group to provide the education, and then continue with the discussion. All right, so last step, which is step 5, monitoring and a follow-up measure. The students need to develop a plan for the patient's follow-up, and then one student will present the patient's follow-up, and then followed with the lecturer discussion and to give the feedback. All right, in the remaining of the 30 minutes for the practical 2, we will have a new case, and students will conduct the PPCP steps, and then will identify the DRP. They will identify the plan, propose the implementation, and monitoring is the same steps with the another case. All right. Okay. So we have done with the activities in the practical 1 and 2. All right. So in this practical, there will be no assessment and no grading, but your attendance is compulsory. Okay, please be reminded that this is a practice for your OSCE that plan to be conducted on July, and it will carry for 20% of your continuous assessment in the OSCE session. Okay, so your feedback, your question, your anything is really encouraged for the students. Okay, so the manual and the venue of the practical, I will upload them in the U-Future, and you can refer to the U-Future. Okay, so in the manual, students, you need to fill in and complete the worksheet in the manual during the practical. However, no checking will be done by the tutors. This for your own references and for your own material lah in the future. Okay, so that's all. I think you can WhatsApp me and contact me, or you can meet me in my office at level 9 if you have any question or inquiries. Thank you.